And we have a great panel assembled for today's virtual panel to discuss COVID-19 research being conducted at the School of Public Health or being planned at the School of Public Health. The people on the committee who will be talking today, or at least getting us started, we have 5 faculty members, but I hope that throughout the call, people will be able to comment. The way we have this structured is we're going to start off with a brief introduction, which I'll make, and then I've asked each of the panelists to just provide a short overview of some of the work that they're doing and that they're aware of taking place at the School of Public Health or being led by faculty at the School of Public Health. And then we'll have a half an hour for open discussion. And so with that, I'd like to get started and introduce our panelists. I'm going to first introduce all 5 of them, then I'll go back to the start and ask each of them just to provide an update on the research that they're aware of and that's being conducted. So we have Dr. Emily Levitan, who's an associate professor of epidemiology. She's also the co-director for the Center for Outcomes and Effectiveness Research and Education. We have Dr. Robin Landsey, who's a professor of health behavior and the graduate program director for the Department of Health Behavior. And she's co-director of the Behavioral and Community Services Core in the Center for AIDS Research. We have Dr. Pia Sen, who is a professor of healthcare organization and policy. And Dr. Sen holds the Blue Cross Blue Shield Endowed Chair in Health Economics. We have Dr. Suzanne Judd, who is a professor of biostatistics and director of the Lister Hill Center for Health Policy. She is also the principal investigator for the REGARD study, as well as for the recently funded rural study. And last but not least, we have Sudeep Shrestha, who is an associate professor of epidemiology at UAB. So with that, maybe I can, I was just going to do this in alphabetical order and start with Dr. Levitan and ask her just to spend a couple minutes providing an update on some of the research that she's aware of taking place, whether she's involved with or not. Dr. Levitan, if you can get us started, that'd be great.
Thank you very much. I appreciate the opportunity to talk about initiatives that I'm involved with and that I'm aware of. So I guess to start with, as Paul mentioned, I'm the co-director of the Center for Outcomes and Effectiveness Research and Education. As part of that role, I am coordinating a working group to look at outcomes research around COVID-19 at UAB. Right now, we're in the early phases of this, where we've been doing this for about a week in an organized way. And so really setting up the infrastructure to get this done. And I think we have a pretty big working group with representation from the School of Public Health, and we'll be broadening that out as we get some structures in place. So the broad idea with that initiative is to coordinate work with UAB healthcare system data, consider how we might continue follow-up for those individuals through research purposes, and then also making use of the clinical follow-up that is ongoing. We're also looking to see what kinds of data can we and should we bring in from other sources, the community sources, working outreach to the City of Birmingham, Jefferson County Department of Public Health, and Alabama Department of Public Health. So that's a big ongoing initiative. It's a little nebulous right now, but happy to talk to anybody who's interested in those sorts of outcomes questions. The other area that I'm working in is collaborating with a number of investigators, including Suzanne Judd, looking at COVID-19 and the effects of COVID-19 in the REGARD study. And so I am, so I've submitted a grant to do some case finding of COVID-19 cases from the REGARD study. We're also working on a REGARDS MI supplement to the NIH supplement to the REGARDS MI study that would really be focusing on access to care and barriers to access of care for particularly for cardiovascular conditions during the COVID-19 pandemic. I see that Hemant has asked about whether we're coordinating with the Outcomes Research Group from UAB-MC. Yes, absolutely. The Center for Outcomes Research and Education is one of the university-wide research centers, which are by requirement and definition interdisciplinary. And so Mike Mcguinn from Infectious Disease and I are both co-directors of the core, and we're co-directors of the initiative to try and get outcomes research on COVID up and running, or at least to facilitate outcomes research on COVID-19 at UAB.
Okay, thank you, Dr. Levitan. Dr. Lanzi, could I ask you to go next?
Sure, I'm happy to do so. So I'm involved in essentially 3 different arms of research right now that are somewhat related. The first being mental health and student well-being. As you know, we got one at the back of the envelopes, and doing this in collaboration with student counseling services at UAB and with the Dean of the Graduate School and Associate Dean of the Graduate School. And that is focusing on conducting a longitudinal mixed method study, looking at how, from the student's perspective, are they coping with COVID-19? How is it impacting them? And what we are able to do to help support them. So we're looking at the events and factors impacting student mental health during COVID-19, the emotional and mental health responses students are having as a result of these events, how different student populations may be impacted by health, economic, racial, and social disparities, looking at behaviors and resilience strategies students are utilizing that seem to be helping, and looking at the phases of emotional responses to COVID-19 events and circumstances, and distinguishing these reactions, behaviors of these phases. And we're doing this based on a paper that Angela Stowe and a couple of our students are working on, of looking at these emotional phases that we go through in a disaster. Sort of the impact phase, the heroic phase, the honeymoon phase, the disillusionment phase. And often after the disillusionment phase, there's this reconstruction phase of a disaster, but there's not going to be sort of a post-COVID-19. And so what we're looking at is this sort of what Angela Stowe calls getting to the sandbar, and where we can get to, our feet on the ground at some level, and what are the behaviors and responses of us now being on our new sandbar, our new normal, and how are we going to be able to help support staying on that sandbar, not getting, kind of swooped up and back into the ocean. So it has a lot of implications for our students. They've had a lot of impact points. And so we're looking at, with our research, what we can do, and those implications are supporting and responding to them. But as part of that research, doing this phased approach of survey, and a full blast survey across campus with student affairs and the Office of Service Learning, undergraduate research, and again with the graduate school, student counseling services, the School of Public Health, and then doing a longitudinal study with a group of them, and then hopefully doing some focus groups and one-on-one interviews. And so all of that kind of building together to meet our student needs, and that's undergraduate, master's level, doctoral level, postdocs, postdoctoral fellows, as well as our professional students. So that's one arm. and then another arm that with, as you mentioned, with being with the Center for AIDS Research, Behavioral and Community Sciences Core, we are looking at ways through the lens with that, through faith and spirituality research that we can do for those living with and affected by HIV, and putting together a research webinar series for that, where we can discuss the science and the findings and outcomes, pitfalls and success stories right now of what we're seeing, with through the lens of COVID-19. And so wanting to really partner together with the faith and spiritual community along with the scientists, and highlighting sort of, from that model of resiliency and coping, what does the science say, and then what are some great examples from our faith community of how to partner together and what they're doing, so it can be shared, these models, tools of what churches and faith communities can do and help move forward in this area. So trying to move that initiative forward. And so those research series will begin next month. And then the third arm that we're working on is continuing our adolescent and young adult sexual health work, and during this time. And so partners with Tina Simpson, Samantha Hill, Letitia Lopre, Susie Davies, Sue Jones, and Christina Clark O'Karmas from the Alabama Campaign for Adolescent Sexual Health, which was formerly the Alabama Campaign to Prevent Teen Pregnancy, are looking at, again, bringing in ways to work with youth. We had originally planned, a lot of what we're doing right now, as most of us are doing, is having to pivot what we originally planned to do and look at ways that we can continue to do our research, but now through the lens of COVID-19. So we were planning to do some sort of broad-based work, bringing together adolescent health investigators, clinicians, researchers, and community members, but now, and bringing in the youth to work with us and sharing with how they get the information about sexual health and how do they need to get that information. And so now we're going to be switching it and looking at it really, as we are all doing the social distancing, and there are a lot of practices that particularly our youth are needing some help with. And so those are just broad strokes of different areas.
Great, very exciting work. Thank you. Dr. Sen, may I ask you to go next?
Yes, thank you, Paul. Excited to speak about this. So I'm part of about 3 separate projects. Again, some overlap between them. The first one is actually something that's not so much directly the COVID-19 itself, but the fallout of COVID-19 or unintended consequences, if you will. And this is being done in partnership with UAB Pediatrics. And what we essentially want to look at is the extent of crowd out there might have been in the use of other health services, particularly use of emergency department services for children, and trying to track how much of it might genuinely be because we don't see things like car accidents or similar trauma during the shutdown, but also how much of it might just be because they're not being able to access needed services. So basically we are thinking of some difference in difference framework. We want to look at how the beginning of this year compared to the beginning of 2019, but relatively to that, once the shutdown rolled out, what have we seen in terms of actual visits from electronic medical records? We want to look at that phase pretty much through June, and then to see when we do start opening up again, whether there's a surge. So that's just the quantitative looking at the electronic medical records piece. But parallelly, we are launching a couple of surveys once we have IRB approval. And these are intended to ask parents and guardians about what they felt about unmet health needs during the COVID crisis for their children, and very importantly, whether they had access to telehealth facilities, be it being made aware that they were telehealth facilities, being able to access telehealth, being able to use it, and so forth. So that part of it is being supported by the School of Public Health through the back of the envelope. We are very grateful for that. So all of these studies are basically in different phases of getting IRB approval right now. Apart from this, we have two more projects. One was actually started by the two students in my doctoral methods class, which we are now wrapping up via Zoom. And one of them is a program director in School of Health Professions. The other is a doctor at School of Medicine at UAB. And they have been very interested in hunting down various secondary data sources for sort of COVID positive cases, the profiles, the growth profiles in different states, and linking that up with BRFAS level information on prevalence of various chronic conditions in states. So we hope that since that's all secondary data, we are hoping that this will be a quick manuscript that they can provide. They started on this as part of the doctoral project in class, and then are very enthusiastic and want to continue with this further and write up something over this. The final project is actually the one we started first, and this was trying to do a fairly in-depth census tract level characteristic-based risk index within county. And our main purpose here was to really see if this would help provide some guidelines about where you might want to go in and do more surveillance and more testing, because while a lot of our models are county-based, given the shortage of tests, sort of just randomly testing the whole county, if that's not feasible, can we do something that's more drilled down? So based on what we know about the risk factors of COVID, we have built and shared that particular map with Alabama Department of Health, Alabama Medicaid, Jefferson County Department of Health. The next step is to see whether we can validate to the best of our ability that risk map for the greater Birmingham area, with the caveat that all the data we have now is very imperfect. And sort of there's different ways we're trying to do that. Emily's helping me get access to the UAB hospital records. So I'm very grateful to her for trying to handle the IRB on that front. I'm engaged in the interesting challenge of learning I2B2 and how to work with that system for the first time. We are also working, one more thing that's going through UAB Legal and IRB, to get access to the data for the website that was launched, the Help Beat COVID, where people could log in and self-report things like symptoms and their if they tried to get tested, if they were able to get tested, pre-existing conditions, a whole lot more information. So that's sort of going through both UAB Legal and UA Legal, because it was a joint project. So all of those are sort of irons in the fire. A lot of that is right now dependent on when IRB and Legal gives us permission to move to the next step.
Great, thank you. Dr. Judd, could you go next?
Yeah, absolutely. So I've got a couple of projects that are related to regards and rural. In regards, there's obviously a good bit of money right now in terms of supplements related to COVID-19, and we've started a working group to talk about what we might want to do. Emily Levitan mentioned she's already submitted a grant so that we can ask people, were you diagnosed with COVID-19? Did you get a diagnostic test and was it positive? Do you think you had COVID-19 even if you weren't diagnosed? Then we can pursue those medical records and see what was happening in those folks. Along with that, there's a lot of confusion with the virus around long-term consequences. So I also have a student doing a lit review on previous coronavirus, novel coronavirus outbreaks in MERS and SARS, and what the long-term health consequences, particularly cardiovascular, were after both of those epidemics. And then for comparison, she's also going to look at some of the novel influenzas as well. In regards, we've also pitched around looking at attitudes and perceptions of risk in various groups, looking at racial and regional differences in those attitudes and perceptions of the risks associated with COVID-19. We want to look at healthcare access and self-management behaviors, self-care management behaviors in those folks. In particular, did they stop seeking care for routine medical conditions? Did they have appointments canceled that they had a hard time rescheduling? Questions along those lines. And then also attitudes and perceptions about social distancing measures. In the rural study, we're currently doing focus groups in Wilcox and Dallas County anyways. We're doing those digitally via Zoom. So we're talking about adding in some COVID-19 questions to get it, again, those very same attributes we talked about in regards the attitudes and perceptions, healthcare access, and how social distancing has impacted their community. We're looking at mortality in Dallas and Wilcox County. Anecdotally, we talk to our partners in Dallas and Wilcox County every single day, and they tell us about what's going on down there, and they tell us that another person has died. Yet when you look at ADPH's portal, it doesn't appear that people have died. So we're interested to see if there's something going on with an increase, a spike in mortality, but that doesn't get reported as COVID-19. In the rural truck itself, we'll be doing COVID-19 testing on everybody for both actual infection at the time and then also antibodies, because we're assuming by the time the truck gets there in November, there will be an antibody test so we can see who has recovered from COVID-19, and that'll just be a part of the rural baseline data. And then we're looking at some consequences to rural communities due to COVID-19, particularly in Alabama, although Mississippi is doing something as well. Eric Ford and I are doing a comprehensive review of stay-at-home orders with students, MPH students, both in Alabama and beyond, but the focus here is really looking at essential versus non-essential. Every unit had the opportunity to declare what was essential. So we're going to do some comparing across various states of essential versus non-essential, and then tie that to cell phone movement and see if some of these measures, if there are differences in how they're implemented, does that change the way people are moving? Just for kicks, I've been doing a lot of model building in comparison. I'm a chemical engineer by undergrad, and the opportunity to work with differential equations again was actually a lot of fun for me. Got to pull out some software I hadn't used in a while. A lot of the models that they're using with the Institute of Health Metrics and Evaluation rely on the ability to solve 3 differential equations that look at the likelihood that someone moves from susceptible to exposed, exposed to infected, and then infected to recovered. So I've been doing some model building locally in Alabama, trying to figure out what are the parameters to those models. You know, who's moving between bins, rather than doing it at the macro level, the way IHME is focusing locally on what's actually happening. And then I've been working with Lisa McCormick to supervise students at the health department that are doing contact tracing as a faculty supervisor. And that's it.
Well, that's a lot of great work. Thanks for sharing. Sadeep or Dr. Stresha, could you go next?
Yes, thank you, Paul. So immediately what I'm involved is in a project within my R01, which is in Kawasaki disease. It's a disease in children, and it's not a common disease, but several years ago, there was a paper that showed an association with some type of coronavirus and Kawasaki disease. The etiology of Kawasaki is not known. I mean, ours is a genetic study, and we are also prospectively collecting samples here at Alabama Children's and also Seattle's children. So what we proposed in a supplement, like anybody is doing right now, and we've already submitted that supplement, was to look for the presence of either the virus or the antibody in these Kawasaki children, Kawasaki disease children who show up at these hospitals. At the same time, we also need a control, just to test for other children. So I've been talking with Suresh Bobana, who also has a IRB separate from the UAB enterprise IRB to collect samples in children. And I'll probably have to talk with Pia, because Pia mentioned something interesting, because children with Kawasaki probably may not be coming to the children's hospital right now. And that has been shown through the Kawasaki Disease Consortium, like in Italy during the peak time, there were no Kawasaki disease children coming to the hospitals. And as it's declining, there have been several cases of Kawasaki disease children showing up at the hospital. In the US alone, there's only been 2 cases documented, but maybe most of them are not. So we put in a supplement to test for, either antibody or do the, viral testing. We immediately worked with James Covey in the School of Medicine. And he said, if anybody wants to do antibody work, he's welcome. He's going to welcome any collaboration. He does have a BSL 2+ lab. So for those who need samples, you may need to be aware of, the guidelines within UAB or, overall guidelines as to how to process the samples. You may be able to collect the samples, and store it in your lab, but to process it, you need to have BSL 2+. I think UAB is saying BSL 2+. Other institutes are requiring BSL 3. So it depends from institute to institute unless we get the guidelines. The other group that I'm working with is from the start, we formed actually a genomics group that turned out to be an omics group. Hemant, Tiwari, Aken Ojisina, Ryan Irwin, Bertha Hidalgo, and James Tang. Until last week, we've been meeting twice a week. And from this week onwards, we're gonna meet once a week. Our group is a little bit unique because we are trying to see where we can archive samples. So we've been trying to work with UAB folks and also outside of UAB. The whole, concept started with, I don't know if most of you know, but there is the Alabama Genomic Health Initiative, project started by Bruce Corp. So they have genetic and genomic data already typed on 6,000 individuals in Alabama, and then it's linked to the EMR database. For those who come to UAB, it's a little bit easy because, we can access, and see whether they are positive for COVID or, whatever the disease progression or severity or whatnot. But for outside of UAB, it's a little bit difficult, to track. So with that in mind, we've been trying for a long, long time to connect with, and Suzanne was involved in the beginning too, to connect with ADPH or Jefferson County Health Department. We don't want to overwhelm them too much, but last Friday we had our first call regarding the samples. The person who joined the call was Melissa Morrison. She's the CDC field officer for Alabama at ADPH. Our group is interested in samples and whatnot, but we had to be a little bit naive in the way that, to open up and say, what can we do as well? We are aware that several other individuals are involved, like Suzanne and Lisa and maybe Pia and others. But our group will try to connect all those individuals who might be interested if they propose something to us, because some of these might be beyond our expertise. So we've also tried to pitch to them and say, maybe we can develop, 3 types of cohorts, one for adults, one for pediatrics. Although small numbers, we still have around 200 people, 200 kids under age of 18 in Alabama. Last time I talked with Suresh Bobana, there were only 2 kids who were positive under 18 here at UAB or the Children's Hospital. And the third one is the healthcare workers cohort. And that was something pitched by Hemant. So maybe he can talk about it more. Within our group, Bertha, I think she might be here on the call. Bertha is the one who's spearheaded several projects. So she may wanna say something about all the good things that she's been doing. And lastly, there is the CCTS, UAB Enterprise Biospecimens. So I was invited to serve on the governance committee. So we had our first meeting on Monday, and the second meeting will be today. They're trying to find a better way to see, how to provide samples to all the requests. Even before they launched their website to fill out the request, there were already 16 requests that have been going. So if any of our School of Public Health investigators need samples, let me know if I can help. So that's all that's going on our side.
Great. Well, thank you. I'd like to thank you, Dr. Shrestha, but also all of the panelists for getting this conversation started. Obviously, even just between the projects that the 5 of you mentioned, there's a lot of work going on. And I guess I'd like to ask a question to each of you about if there are people who are interested in getting involved in projects, or either projects you've talked about or they have new ideas. How would you recommend they go about that? And maybe I can start off with Dr. Levitan with the work she's doing with the core.
So the work I'm doing with the core, I guess there's 2 answers. So one is that, I2B2 has the data for the UAB COVID positive patients. There are limitations to that data, and it's not necessarily, as Pia probably can vouch, it's not necessarily in a format that is user-friendly. So one of the activities that the group that I'm co-chairing is doing is trying to come up with a more useful data set that's going to have, data elements that match the kinds of questions that we tend to ask. And it's going to be, in a format that is a little bit easier to deal with. The informatics folks like that because, in part because, they are telling us, well, there's like, I don't know, 16 million pieces of information about COVID patients. And so thinking about, how do we make sense of that? And how do we actually take those 16 million pieces of information and put it into a form that makes some sense? We are developing, so right now we have a couple of working groups that are more sort of infrastructure focused, and we're developing scientific working groups. So if you want to be added, we're developing a website that will be up that will allow for, seeing what those scientific working groups are and proposing others. The other thing that we're doing is coming up with a concept proposal, sort of similar if you're familiar with any of the big cohort studies that have, paper proposals. It's a little bit different because, you don't get the regards data unless you fill out a paper proposal. This data, we have no intention of controlling. The idea is to, if you fill out a paper concept proposal, we can help you, link you to the data sources that we think best help you answer that question, and also link you to resources like the BIRD that will help with analysis if needed. And finally, to sort of make sure that people are not operating without knowing it in parallel. So that website, I think it's sort of half built at this point.
Okay, great. And we can always get that circulated if it'd be helpful once it's up and running.
So
sorry, go ahead.
I think, to Sudeep's point about the enterprise protocol, I think a little bit of expectation management might be helpful. So yesterday, there were 56 patients who had consented to that enterprise protocol, and I don't think that they have samples on all 56 people. So, as epidemiologists, 56 is a starting point, but it's usually not sort of the numbers we're looking for. For Hemant's question about I2B2, So that's a different, right? So there's sort of different subsets of data. So I2V2 pulls medical records. We can get, there's more than 302, I mean, I think, but it's just a matter of case definitions, and we're working with Matt Wyatt and James Willig are taking point on the case definition from the I2B2 standpoint.
Okay, great, thanks. And do you know if there's, and I'm not sure if you're the person to ask this or maybe someone else can answer this, about partnering with other institutes within the CCTS network to get the numbers, to get larger numbers, since, as you point out, as of yesterday, the 56 positive patients is not a huge number.
Mm-hmm. So 56 positive patients who consented to biospecimens and recontacting. That's what that 56 is. There are ongoing efforts within NCATS, which is the funding agency for the CCTS, and that funds other similar organizations across the country. The process, I mean, I am a CCTS investigator. I would say that it's a little opaque to me exactly how that's going to work. And you know, what the processes for getting access to that data will look like and what's going to actually be in that data. So yes, that's ongoing. What that looks like, I don't know. I would say Matt Wyatt and Jim Semino and Jake Chen are the people who are taking point on that from the CCTS. Within what I'm working on, I am trying to to the extent possible, make sure that the data that we have, the data sets that we're building and pulling from the health system are concordant with a group of institutions led by Weill Cornell that are also collecting data on hospitalized patients. We have established collaborations with Weill Cornell. They've shared all of their data forms and they're sharing them with other institutions. And I think that those data capture instruments are going to be a little bit more nuanced because they're because they require sort of more human input to them than what I suspect NCATS is doing. But you know, there'll be both of those potential options for going beyond UAB. We're also talking about, you know, so UAB is currently, you know, working with other institutions locally. And we're talking about potentially, once we get our data structure, or, you know, as we get our data structured, working with other hospitals in the region to do similar data structure and analysis structures.
Great.
That's all kind of nebulous, but it's working on it.
Okay, great. I'm not sure if Dr. Judd or Sen or someone else wants to expand on that in terms of opportunities to get involved. And while they're answering questions, if people have their own questions, please feel free to use the chat function and to post your questions so that I can read them out.
So I think there are lots of ways that you can get involved if you're interested. The key first step is kind of thinking about what piece you're interested in. Are you interested in the psychosocial piece that Dr. Lanzi was talking about? Are you interested more in the data that are out there? The ADPH has data in addition to I2B2, like Emily was mentioning. So there are lots of different avenues that can be explored. There's the data that's on the Beat COVID-19 site. Hopkins is collecting all the data internationally and nationally on a GitHub site. And there's tons of free code out there that's well documented and explained, so you can do just about anything. The question really gets back to what's your research interest and who do you want to partner with to do that project? Honestly, there's more data out there than real people to begin to ask the questions.
Okay, great. We have a question in the chat box. Let's see, do we know what data Dr. Jerry Mcguinn is using for his forecast models? I'm not sure if someone can answer that question.
Hospitalization data, the same data Emily's talking about.
Yeah, this is Paul Irwin. he's getting reports directly from the AIMS system, the hospital reporting system, I believe. Something over 120 hospitals and a few other facilities besides hospitals are sending their data into him on a daily basis.
Great. I was just emailed a question. Are there opportunities for staff to work on any of these research projects, especially those who have time and have a little bit of extra time right now with different other research projects being interrupted?
For me, this is Robin Lansey. I would say absolutely. And particularly, as Dr. Judd was mentioning, for me, it's more around the sort of behavioral and community sciences perspective, and lots of things that staff, students, and faculty are welcome to join in these efforts with us in these various arms of research that broadly focus on behavioral and social sciences, community sciences, and looking at sort of these behaviors and resilient strategies that many are using, and looking at the phases of emotional responses and ways that we can be beginning to support. And we are in a number of these, like Dr. Levitan was saying, we have a number of research groups that are working on these. So I'm happy to bring people into any of those different aspects, and lots of ongoing meetings for those, both virtually as well as just going back and forth via email. So there can be different levels of involvement as well. But it's open to students, staff, faculty, community partners too, especially. And I would say that I think that's a critical piece that we as School of Public Health, as a School of Public Health, and locking arms with the community and having them as partners, equally as partners in this work, and really having them help inform us of what their needs are and how we can help be a source of support during this time.
And I think to that point, PCORI just put out some funding announcements that are very much focused on relationships with communities and partners, as well as patients.
Okay, great. So there's some questions in the chat box about pregnancy and newborns, which I think is definitely an interesting population. And I saw Dr. Schakowsky was on the phone. I know he does a lot with the OBGYN group. I'm not sure whether
I'm on. This is Martha. I'm on
great.
as well, and we're. I don't know if Jeff is doing anything, but I've had a lot of conversations with folks in neonatology and OBGYN, and Jerry is actually pulling some data just to get an understanding of how many women we're talking about in Alabama, and there's some interesting questions related to newborns that we want to ask. So I may follow up with Emily and Suzanne about that as well. So I think we're just trying to, at this point, for the Alabama Perinatal Quality Collaborative, trying to get a sense of magnitude. Right now, I think Jerry pulled something like 231 pregnancies or pregnant women, and also trying to get a sense of what policies are going on within hospitals. So we have a webinar with providers next week to have some conversations, because I think there's a lot of information that's going out around sort of what should happen through ACOG and AAP, American Academy of Pediatrics. But I think there's definitely some room on the OB and pediatric side to have some lessons learned sharing from the clinical side. So we're working through that.
Okay, great. And if there are people interested, I'm not sure if there are opportunities for other people interested in the maternal child health issues. Should they reach out to you, or?
Absolutely.
Okay, great.
Paul?
Yes.
Hi, it's Robin. So this just makes me think about how wonderful our school is, and how we have such great varied interests, complementary interests, and opportunities to engage and collaborate. And I appreciate you so much putting on this forum for us today. I wonder if there's a way to have sort of an ongoing place to where, I don't know if it's under our great new website that we have, a shell for this, or something under Canvas for all, faculty, staff, students. I'm not sure the appropriate platform, but that it could be a place where us as School of Public Health people can go and say, we got this going on, we got this going on, we got this going on, you can join this way. As we're sharing now, I think it would be wonderful if we could somehow capture that and have it a repository of where we could go and continue to do that. I don't know if it's through Microsoft Teams or what.
So I think that's a great idea. It's one of those things where Madeline, Paula, and myself were trying to track the research in this area that's taking place at the school, because we get contacted by Kent Kaiser and Chris Brown requesting that information. So if we were to be able to track it in a better format than just reaching out to people ad hoc, that would be great. So that's something that we'll definitely work on. So thank you.
Yeah, I was just thinking, let us make it easier for you too, because that's
Right.
a lot of work on your part, and probably just as easily upload something there.
So I'm going to go back to Dr. Sen. Hopefully you're still on the phone. I want to go back to something that you brought up earlier, which I think is very interesting. It has to do with some of the analyses on the differences in difference.
Mm-hmm.
And, really, thinking about COVID obviously itself is having a major impact, but then some of the secondary consequences, people not going to their doctor's appointments. I saw an article about vaccination rates dropping. And I'm not sure if you could talk a little bit more about some of the work in that area for people who are interested in doing research, but maybe not necessarily directly related to COVID, but they're interested in it in terms of cancer, cardiovascular disease, maternal child health, and its other consequences.
So certainly. So my interest tends to be more on the pediatric population, but from a lot of things that and I'm sure everybody else is reading, there is a lot of questions around why are we seeing some of these drop-offs. There was a headline, I think, in New York Times that says, well, stroke and heart attacks don't take a break. So why are we seeing these fall-offs in other types of ED visits? And I think at this point, while there's clear evidence that other healthcare service use has dropped off drastically, what types of services might have dropped off is a little more anecdotal. And the reason why I was particularly interested in the ED visit piece is because there's potentially two stories. One is sort of ironically, there are actual beneficial effects of this shutdown with people not getting into car accidents or similar trauma. Whether it's really just that the fall off we are seeing, is it coming from a fall off in certain types of visits? The bigger concern, we got into this project because my research partner, who's a pediatric emergency doctor and research director, she was genuinely concerned that they were seeing a sharp drop off in what she considered fairly sort of valid conditions for ED visits. And she felt that when they were seeing the patients were when they had reached a higher acuity in those disease conditions, that they were essentially postponing their ED visits, but coming in when they were really sick. And honestly, we got to the point of, well, let's really just get into this and study what's happening. And the reason why we also want to do the survey is the data is only going to give us about half the picture. The other half is actually seeing how we might actually reach out to parents and guardians and ask if they perceived unmet health needs. And I should say that this study in a way is a precursor, but the HCOP, we have several faculty, we have partnerships with Alabama Medicaid and Alabama Children's Health Insurance programs and research contracts ongoing. And I think one of the things that's pretty high on our list to do next year is to study this sort of fallout and not being able to get needed care on a wider basis using all Alabama data, and particularly to see who was able to versus who was not able to access telehealth, because this is really sort of telehealth's moment. And if there was ever anything that really emphasized that telehealth would become an important player in the future, then I think this has really driven home that point. So we think that's another avenue that's well worth looking into, the role of telehealth, who's being able to access it, who's not being able to access it, what that does to sort of health disparities and exacerbating those disparities.
Great, thank you. I mean, I think that telehealth is here to stay, and I think that we need a lot more research in this area. So it's great to hear that there's interest from, I know Dr. Eric Ford is doing some work in this area as well. We have a note from Dr. David Vance, who's the Associate Dean for Research at the School of Nursing, about basically interest in collaborating and opportunities for cross-school collaboration with the School of Nursing. Additionally, Dr. Christy Manier from the School of Education is on the phone, and I know that there's been interest at the School of Education for collaborations as well. And so I just want to mention that to everyone, because I think there are definitely some unique opportunities there. I'm not sure, we have, sorry, please go ahead.
So I'm going to advocate for our, omics group a little bit here. Like Emily said earlier, there are like 56 individuals who have consented. Last time on Monday, they said they got the samples from like 26 individuals. So for the School of Medicine, who do mostly basic science, 26 is enough for them. So even based on what I get a sense from the CCTS, they have reached out to their other partners, but they haven't gone to the community level. Is there a way, our group was trying that, but maybe it should be done at the school level. Is there a way to establish some kind of, cohort at the community level or at the state level, working with ADPH and Jefferson County Health Department, so that we go above and beyond, UAB? If we can get samples, that's great for our group. If not, with all the wonderful work that everybody's trying to do, should we get a blanket IRB to work at the community level?
So that's something they say, let's continue this conversation and think about that. We're nearing the top of the hour, and since I know a lot of people may have meetings at 11, I'd like just to end this early with a couple of closing comments. The first of which I'd like to thank the panelists for their insights and sharing their experiences. I think it's great to hear about the work they're doing, but also the opportunities for collaboration.